Hi, Brittany. My name is Darren. I'm an occupational therapy student at UNLV. Are you familiar with what occupational therapy is?
No.
Well, occupational therapy focuses on things you want and need to be doing in your daily life. So, getting you back to be able to do certain things like bathing, dressing, grooming, and certain hobbies you might have.
Okay.
So, do you know why you're here today?
I had left hip surgery recently.
Okay. So, today we're going to go over some hip precautions for that hip.
Okay.
So this is a handout to help you remember the precautions we're going to go over today. So there's three main things we want to cover. The first one is no bending over past 90 degrees. So while you're seated, always make sure your knee is positioned higher than, or your hip is positioned higher than your knees. So that's one way to remember that you're maintaining that 90 degrees. So try to avoid reaching and breaking that 90-degree precaution. And there's a couple things we can use to avoid breaking that 90-degree precaution. This is a reacher. So instead of, if you're seated and you drop something, instead of reaching over and breaking that 90 degrees, you can use this. By squeezing this handle, you can grab whatever's on the ground.
Okay.
So that was our first precaution, no bending forward past 90 degrees. The other one is no crossing your legs. So you want to try to avoid crossing your legs when seated or in bed. And if you're seated, one way to remember this is just position both feet flat on the floor.
Okay.
And the last precaution is no pointing your toes inwards. So do not let your surgical side, which is your left side, do not let your left foot or your left knee turn inwards and point towards your opposite leg.
All right.
So I just want to make sure you have a good understanding of your precautions.
Mm-hmm.
Do you think you can summarize what we went over today?
Yes. So no bending past 90 degrees, no crossing my legs when I'm sitting down or laying in bed, and no pointing my toes inwards.
Yeah, perfect. And I'll leave this handout with you so you're reminded at home what your hip precautions are.
Okay.
And you can go over this with your family, and they can also help you remember these hip precautions.
Okay, thank you so much.
Perfect. Thank you.